In today's video, I'm going to be talking about piles. You might be watching this because you're really hoping I'm going to give you the answers so you don't have to call up the GP surgery because you're pretty embarrassed to talk about it. Well, lucky for you, I will give you lots of answers and you may not have to call the GP surgery. But if you do, don't be embarrassed because piles are so common. So many people have them and usually they're not too much to worry about. So do watch the video where I can tell you what they are and how you can help manage them. Piles or hemorrhoids, it's just a different word for the same thing, and these are swellings of the blood vessels within the bottom, so that's the anus and the rectum, and they can be inside the bottom, so we call those internal hemorrhoids, or they can come outside and we call those external hemorrhoids. And sometimes you can use your finger and push them back up, sometimes they do pop back out again. And you may have noticed things like when you do open your bowels, within the toilet bowl there's loads of bright fresh red blood and it can be quite frightening, and you might have noticed there's like a sense of fullness in your bottom. Your bottom can be itchy and sore when you open your bowels, and sometimes afterwards as well, and there can even be mucus in your poo. And those things are all really common and normal within piles, but if those symptoms don't get better when you've tried to treat them yourself, which I'll talk about in this video, then do call your GP surgery because it would be worth getting checked out just to make sure there isn't anything else going on. So what causes piles? Typically the most common reason is due to straining, so that causes increased pressure, and that's because you're constipated. I've got a video all about constipation, so do watch that for a bit more information, but that's because you're not having enough fibre in your diet, you're not drinking enough, you're not moving enough, you're carrying too much weight, you're spending too long on the toilet, or you're holding it in when you actually should go and open your bowels. But sometimes it's due to factors that are outside of your control. So pregnancy, sorry women out there, that's a big one, can cause hemorrhoids, and then labour, when all that pushing, that's obviously going to increase the pressure down there. You can have a family history, so that just puts you a bit more at risk. Other things that can increase your risk of hemorrhoids include things like heavy lifting. So that might be because you're at the gym working out, it might be because your job involves heavy lifting, or maybe you've just, you're a parent and you're forever picking up your heavy toddler. All those things can increase the pressure. Persistent vomiting and coughing, or even sitting down a lot, all those things can increase your risk of getting piles. Management. Well, first things first, you have got to do all you can to avoid constipation. So that's things like having more fibre in your diet, having more fluids in your diet, not too much of the alcohol and caffeine, being more active, avoiding sitting down for too long, losing weight if you're carrying extra weight. All those things are going to help prevent the constipation or help get rid of the constipation so that you are less at risk of getting piles. Other things you can do, you can go to the pharmacy and you can buy over-the-counter treatment without a prescription. You can get suppositories, creams and ointments to use in and around the bottom. A lot of these have got local anaesthetic in, so that helps really with the pain and discomfort. And some of them have a mild steroid in, which also helps with the inflammation. If they have got a steroid in, then you can only use them for 7 days at a time, so just be aware of that. Other things you can try is pop some ice on your bottom a few times a day. That can help really cool and soothe and help with the inflammation. Try and wear some cotton underwear and some loose, comfortable clothing that helps kind of air it out and keep it dry. You might also just want to take some regular painkillers, so paracetamol or ibuprofen if you can have them. Another thing that you might not have heard of is something called a sitz bath. Now I'll put a link in the description for this. And this you can buy inexpensively online, and you put it over your toilet, and essentially you bathe your bottom in kind of some warm water. Some people like to add some salt, and this is really soothing for the hemorrhoids. It helps keep them clean and it helps keep them more comfortable, and it helps get rid of them. So have a look if you want to try a sitz bath. If you try all this and yet your piles are not getting any better, or you've got very serious, severe piles that are causing you lots of discomfort, then sometimes you do need to go and have some hospital treatment. This is very much kind of like last ditch though. There can be some non-surgical treatments such as rubber band ligation, where they kind of pretty much tie a rubber band around your piles and then they drop off. Or you can have surgical options such as what's called a haemorrhoidectomy, which is a surgical removal of the piles. But this is really apparently very painful and they can still come back. So the surgeons always say, please, that's absolutely last resort. So I would say focus on all those lifestyle changes, get the creams from the pharmacy, but do get checked out if you're worried there might be something else going on, because we're always happy to talk and we do not get embarrassed to talk about piles or bottoms or bowel movements, so don't worry about that. So that's it, that's piles. I hope you found that really helpful. Have a look, like and subscribe my channel. I've got loads of other videos on there. I've mentioned the constipation one, there's plenty of other ones. I'm sure you'll find something else really useful. Thanks for watching. Yeah, you're a bit dirty. Oh no, she's actually dirty. Are we done?
Yeah.
You are dirty. You're a dirty, dirty dog.